if someone has high intracranial pressure for a while, it can affect the pituitary gland. And the pituitary gland is the master organ controlling hormones. So oftentimes patients will get an interruption of the communication with the pituitary gland to the adrenal gland. And we tend to get a poor response to stress, for example, body stress or mental stress, because we can't kick out enough cortisol. It can be intermittent, which is interesting. But I've seen so many patients and their doctors explore the possibility of Addison's disease or secondary Addison's disease, and it isn't quite that. And most endocrinologists don't think about it. They just don't recognize what's going on. Mine was wonderful because she was willing to keep her mind open. All this was new to her. But we eventually recognized that it was intermittent. But there were times when it was bad before my pituitary really popped back, and it does eventually pop back, that I needed a little steroid once in a while in times of high stress. And I recognized it because I just felt like I couldn't move. Having said that, it's very easy to slip into all of your symptoms now are due to low cortisol and I need more steroid, and that's not right. So we've seen patients who suspected they had some form of Addison's disease and had taken enough steroid that they developed secondary problems, basically Cushing's, even osteoporosis, gaining a lot of weight, etc. One nearly died from it. And she was a nurse practitioner. And we had to explain to her that, I mean, she wasn't ignorant, right? Had to explain to her that the symptoms look like an Addison's crisis. That's not what that is.